Hello, my name is Danielle Rose and I'm a senior biology major at Mount Vernon Nazarene University. For my honors project, I decided to research the barriers to pediatric eye care in Knox County, Ohio. In this presentation, I'll give an introduction to pediatric eye care. I'll introduce the purpose of my project, and then I will give a brief overview of the methods that I used in my research. I will then overview the results and give a brief discussion of the findings of my research, and I will conclude the presentation. Pediatric eye exams can be performed for patients as young as 6 months old. The purpose of an eye exam is to identify eye diseases and disorders. Usually, with early diagnosis and effective treatment, the damage caused by an eye condition can be reversed and the progression of a disease can be prevented. Usually for children, this also means an improvement in classroom learning and behavior because a lot of vision conditions can negatively affect classroom learning and even cause behavioral and developmental delays. In Ohio, schools are required to perform vision screenings by law. These vision screenings are to occur when a child is in kindergarten or in their first entry into a school district. For example, if it's a third grader's first year in the school district, they are required by law to have a vision screening if they don't see an eye doctor annually. These vision screenings are to repeat in grades 1, 3, 5, 7, 9, and 11 in the state of Ohio. The purpose of these vision screenings is to identify children that are experiencing or are at risk of experiencing an eye disease or disorder that can affect their learning or development. These vision screenings are not a replacement for comprehensive eye exams. Comprehensive eye exams through an eye care professional are recommended to happen yearly for any student, even if they are not experiencing an eye disease or disorder. Children cannot dictate their own eye care. Therefore, this responsibility falls under the parents and guardians who are responsible for the health and well-being of a child. Parents and guardians are responsible for making sure that children receive the eye care that they need. However, studies both in London, England, and in Ghana, Africa, have shown that children who need eye care are not receiving the care that they need. The barriers present in those studies were concluded to be financial obligations of the parent in providing eye care, the inconvenience of care or follow-up of care, and also a lack of education on the parent's end of pediatric eye care. The purpose of this study was to examine the availability of eye care to Knox County elementary schoolers, and also to identify the barriers to pediatric eye care that are present in Knox County, Ohio, and to also begin investigating solutions to the barriers that were identified in the study. My hypothesis was that in Knox County there would be barriers present and that they would include the financial obligations of the parent to provide eye care and also an inconvenience of care and follow-up care for the parent and the patient. I hypothesized that educating parents on pediatric eye care and providing them with helpful resources to learn more about eye care and about resources available to provide eye care to their child would serve as solutions to these barriers. For this investigation, a self-created survey was distributed to the parents of Knox County elementary school parents. This survey was heavily influenced by the works of Donaldson and Ramay in the London, England, and the Ghana, Africa studies that were referenced earlier in this presentation. This survey was voluntary and anonymous. No demographic information that could connect a parent to their answers or a family to the answers provided was recorded. The survey had 9 questions that were mostly a 5-point Likert format, so strongly agree to strongly disagree with a neutral option. And there were also some multiple choice and multiple answer options that allowed parents to choose all that applied to them. The survey was distributed using an online communication system provided by the schools of interest. So a description of the survey as well as a link to the survey was sent to the parents through this notification system. And then the parents could complete the survey at their convenience. And the survey took an average of 2 minutes for parents to complete. The Knox County elementary schools of interest have an enrollment of about 2,000 students, and of those 2,000 students, 14 parents responded to the survey. So this is a huge limitation of my study. That's a very small sample size. However, some discussion can still be made from the data that I was able to collect. So through my responses, I was able to find that the majority of parents did take their children to see an eye care provider yearly or at least once every other year. Their reasoning for taking their children to an eye care provider included preventative care, failed vision screenings, signs or symptoms exhibited by their child, that the child already wore glasses, they had a family history of vision problems, or that they had other health concerns like conjunctivitis or an infection. Of the parents that responded to my survey, 1/3 of them responded that they never sought eye care for their children. Their children had never seen an eye care specialist. Their reasoning for not taking their child to see an eye care specialist was that other healthcare providers, including their children's teachers and nurses that performed vision screenings, did not recommend their child see an eye care specialist. These parents were under the impression that just because their child did not have a vision problem, that they did not need to see an eye care specialist. Therefore, they did not seek eye care for their child. When the parents were asked to identify the barriers that they experienced in providing eye care for their children, they identified financial barriers, barriers in regards to insurance, convenience of care barriers including location and distance from the eye doctor, as well as scheduling inconveniences, and also a knowledge of child eye care, just knowing that their child needed to see an eye care specialist at least once a year. Through this study, I learned that effective communication between school staff, parents, and healthcare providers is essential for pediatric eye care. I also learned that educating parents on pediatric eye care can help them provide their children with the best eye care possible. Something that school staff and healthcare providers can do to help educate parents is to provide them with resources like the examples I have listed on the slide. Prevent Blindness is an organization that strives to do just that, prevent blindness in the general population. Their website, preventblindness.org, has resources for parents about vision screenings, pediatric eye exams, and common child eye problems. The Ohio Amblyop Registry is an organization that helps provide resources for children who are amblyopic, or in other words, have a lazy eye, so that they can have the proper treatment. Children who have lazy eye have to wear an eye patch in order to prevent blindness into adulthood. And the Ohio Amblyop Registry is an organization that provides free eye patches to the children who need it. Organizations like this can help parents provide proper eye care for their child. In conclusion of this presentation, it's recognized that this study was limited by a very small sample size. The conclusions that were made from the results that were able to be collected were that communication and education were potential barriers that had attainable solutions in the Knox County area. Continuing efforts to break down these barriers will provide Knox County children better eye care and prevent blindness for generations to come. Thank you for listening to my presentation. I hope you were able to learn something new about pediatric eye care or about the barriers to pediatric eye care in Knox County, Ohio. If you have any questions, please feel free to leave them in the comments below, and I will do my best to answer them. Thank you again.